So now it's a pleasure to introduce our speaker today, Jackie French. She's a professor of neurology at New York University in the Comprehensive Epilepsy Center at the Langone Medical Center. She's the founder and director of the Clinical Trials Consortium, an academic group that has performed a number of clinical trials in epilepsy. She trained in neurology at Mount Sinai in New York, did a fellowship training in EEG and epilepsy at Mount Sinai and also at Yale. Her research focused on the development of new therapies for epilepsy. She's an international expert on designing clinical trials of epilepsy drugs. She's no stranger to this podium, not only having served as the AES president, but also as the recipient of the AES Service Award. She serves as the Chief Scientific Officer of the Epilepsy Foundation and was given the Epilepsy Foundation Heroes Award in 2013. She's also been an officer of the American Society of Experimental Neurotherapeutics and played a leadership role in the International League Against Epilepsy. And most importantly, she is a straight talker. She says what she thinks, and she thinks before she says it. Jackie.
That was one of the nicest introductions I ever got. Thank you very much, Walter. And thank you very much. It's really an honor to be here today and to see you all. And my topic may be a little bit intriguing to some of you. Epilepsy diagnosis, don't ask, won't tell. So here are my disclosures. I am, as you heard, the director of the Epilepsy Study Consortium and work with a number of pharmaceutical companies to help them bring new therapies to people with epilepsy. As we just heard, the Hoyer Lecture, the purpose of the lecture is to raise awareness about the epilepsies among researchers and the public and provide intellectual stimulation, and I hope that my lecture does provide intellectual stimulation that will promote progress towards finding a cure for epilepsy. You know, if that box is still around, it's really hard for me to see my slides. So if anybody could find that box. My purpose today is to raise awareness about the lack of awareness, and the lack of awareness particularly of people about their own seizures and what we can do about that. So we now know through the Institute of Medicine efforts that epilepsy and the National Institutes of Health and NINDS, that, thank you very much. The plague of short people, right? Right, Amy? That's much, much better. So epilepsy ranks only fourth to migraine, stroke, and Alzheimer's disease in the prevalence of neurologic disorders, and affects more people than autism, ALS, multiple sclerosis, cerebral palsy, and Parkinson's disease all combined. And this is actually an NINDS statistic if anybody wants to know where it came from. But if you asked people on the street, what are the symptoms of autism? What are the symptoms of Parkinson's disease? Or what are the symptoms of multiple sclerosis? They could probably be more accurate in telling you the symptoms of those disorders than they could be accurate about telling you about the symptoms of epilepsy. So despite how prevalent epilepsy is, it's very much in the shadow. And because it's in the shadow, many people in the United States could not describe the primary symptoms of the disease. And more importantly, and what I'm going to talk about today, is that they probably could not recognize it in themselves if they began to have seizures, and they could not recognize it in a relative. When I was talking at my Thanksgiving table this year about the fact that there were seizures other than generalized tonic-clonic convulsions, many of my own relatives expressed enormous surprise. They had never heard that there was any other seizures other than convulsions. Because people don't know about seizures other than convulsions, there's a great deal of delayed diagnosis, underdiagnosis, and probably absence of diagnosis. And I was talking to several colleagues before this lecture and Dave Labiner, who works in underprivileged areas, told me that when he went on a door-to-door survey, he found that 25% of the people who had epilepsy were not diagnosed, had never been diagnosed with the disease. So in order to tell you about this problem, I'm going to use 3 representative patients. The one who never thought to ask, the one who wanted to ask, but how do they start their quest to find out what's wrong with them, and the one who eventually finds their way to a doctor, but even then the saga may continue. So let's start with the one who never thought to ask. And this is the story of Miss G and her mother-in-law. And I'm going to start out this story by telling you that Miss G's mother-in-law never went to her wedding. Now, if you are a woman and you're getting married and your mother-in-law doesn't come to your wedding, you think, is there a problem with me? Does she not want me to get married? And so, of course, all these things go through your mind, and perhaps even more so when her mother-in-law started to make excuses such as, it's too far for me to travel, the hotel is probably dirty, and probably the one that strikes the most concern in a daughter-in-law's heart, I don't want to leave the cats. Now, when your mother-in-law says she's not going to come to the wedding because she doesn't want to leave the cats, you know you're really in trouble. And it wasn't until many, many years later when actually Miss G's mother-in-law had passed on, and she was talking to her father-in-law, and by that time she actually worked for a pharmaceutical company that developed drugs for epilepsy, so she knew a little something about epilepsy. And her father-in-law told her a very interesting story. And the story was the real reason why her mother-in-law did not come to her wedding. And that is that about a year before that, she had developed these spells. And they lasted about a minute or two. And during these spells, she would have unusual behavior that she couldn't control. And it would only last a minute or two, but it was incredibly mortifying to her. And she shrunk her world down more and more as these events happened because she was afraid that somebody would see them. And the worst possible thing would be that she would go to the wedding and somebody would see her having one of these spells. And so she missed her own son's wedding because, as we probably realize now, and we'll never know for sure, but likely she had developed epilepsy. So, why would somebody like that have a symptom like that and never seek medical attention for it? Because to most of the world, there is absolutely no frame of reference for spells, funny spells. We never hear anything about funny spells. What kind of a symptom is that, funny spells? Media never mentions anything about a seizure other than a convulsion. So how would the public know that this could be a medical problem, that this should be taken to a doctor, that this might be a seizure, and the seizure might be a sign of epilepsy? The public has little understanding of other seizure types. Absence seizures, which are brief staring spells, myoclonic seizures, which are body jerks, and probably most importantly, focal seizures, which are the most common seizure type, which tickle one part of the brain, leading to strange symptoms, dreamlike states, unusual behaviors for seconds to a minute. The public never hears about this. When you see seizures in the media, it is almost always a convulsion, as we know. And this is actually, the still here is a picture from a 1950s film called Boy in the Storm. It's one of many media depictions of generalized tonic-clonic convulsions. If you want to amp up drama, particularly now in all the medical shows that we watch, then you'll put in a convulsion. And people, love to see that excitement, that drama of somebody running in and trying to save somebody who's having a convulsion. And even The Simpsons have used convulsions to amp up the drama. Play the video, please.
We now return to battling seizure robots.
but we know that there are seizures other than convulsions. So now I'm going to talk about the person who says, I'm having these funny feelings, so what do I do? Now, if I notice that I, myself, or my child, or my spouse is having strange feelings, or strange behaviors, or strange spells, it's a symptom. And what do you do in 2015 when you have a symptom? You go to the internet, right? The internet's going to solve all my medical problems, Dr. Internet. So let's see what happens if you try and go to the internet and find out what's wrong with you. Well, if you had numbness in your right leg, and you typed in, I have numbness in my right leg, you would get all kinds of helpful sites that would tell you what causes leg pain and numbness. If you have a neurologic disease such as memory loss, you would type in, I have memory loss, and you would find 10 causes of memory loss. You would find out about Alzheimer's disease, etc. But what happens if you type in, I have funny spells? Well, you get to know a lot about magic. You get a little bit about Harry Potter, but you certainly get nothing about epilepsy. So let's say you're a little more sophisticated, and you go to WebMD, and you type in, I have strange episodes. You get nothing about epilepsy. You get something about cardioverting. You get schizophrenia. So what exactly are you supposed to do to find out that these spells could be epilepsy? Well, you know, interestingly enough, if you type these things in, you're not going to find the answer, but it actually took me about 5 minutes to find a whole community of people on the internet who are trying to find what's wrong with them. So I thought to myself, if I had some of these symptoms, what would I type in to try and figure it out? So I came up with a couple of things. And one of the things I came up with was dreaming while awake. And I came upon several posts. This is an example. Every so often, I suddenly get thoughts in my head as though I'm remembering a dream I've had. This feeling usually lasts for about 15 to 20 seconds, over which time the memories become increasingly intense. Then all of a sudden, it'll stop, and I'll feel like I'm going to be sick for about 30 seconds. After approximately another minute, I've forgotten most or sometimes all of the thoughts I was having. Now, every epilepsy specialist in the room now knows immediately that this person is describing a complex partial seizure. And then the person posts, while this is happening, I'm still awake and aware of what's going on. Any ideas what this could be? And without very much difficulty, I found story after story after story that was clearly people having seizures trying to find out what's wrong with them and not having any way to do it. And as you can see in this post, you described exactly what I've been feeling. It sucks so much. It sure does. It sucks to have seizures and not know what's wrong with you. And then this post, I'm stunned right now. I've been having these exact symptoms for probably 3 years now, and only on a whim decided to Google them to see if there might be any mention of something similar. It's great to hear from others that have experienced something like this. I feel like less of a freak now. And followed by 422 posts of people going, oh my gosh, I have that too, I have that too, I have that too. And finally, somebody posting this: to all that are experiencing the weird episodes, you must see a neurologist. I experienced them for years, and it turned out to be epilepsy. I kept getting misdiagnosed because I couldn't explain them until suddenly I had a big grand mal seizure, convulsive type, and I had learned that all these weird deja vus were nothing more than seizures. Please talk to a neurologist. So as I will be showing you in the next few minutes, these people have to go on having these episodes over and over again for a very long time, and eventually, when they have a convulsion, which is the seizure type that we have told the media about and told the public about, then they can get their diagnosis. So I'm going to tell you another story, and this is a story about somebody who actually did make it to the neurologist's office, and this is Devin D. So Devin D. is a lovely young man, had a promising career in front of him, really nice young man, who started having these episodes where he found that he was trapped on a certain thought. And when he got trapped on this thought, everything in the world would fade away, and it would last about 30 seconds, and he couldn't exactly hear what was going on around him, and he thought these were very strange and unusual. So he did go to a doctor. He went to his primary care doctor to try and figure out what was wrong with him. The primary care doctor sent him to a neurologist. The neurologist, again, was not somebody who saw epilepsy that frequently, did an EEG, it was normal, and said, you know, I really think you should go see a psychiatrist. So Devin went to see a psychiatrist because he was the kind of guy that does what his doctor says. And for a year, he went to the psychiatrist as the episodes became more and more and more frequent until he was having 2 of them a day. And it's pretty amazing that nothing terrible happened to him during that time. He didn't crash his car or anything like that. But it was very, very disturbing to him. And finally, after his family witnessed this over and over again, they said, please go get a second opinion. And a 24-hour ambulatory EEG very clearly demonstrated that he had been having thousands and thousands of complex partial seizures. And the interesting thing is that the first dose of Tegretol he got, and this was about 15 years ago, and they went away completely, and he has not had a single seizure since he got treated. And he is now an extremely grateful young man who's following the path he should have followed, got married, had kids, is rising in his career and doing extremely well. So the question comes up, can even doctors always diagnose epilepsy? And have we given them the tools to do so? Because many people come to our center after seeing neurologists who are focusing on the convulsions and not focusing on the smaller seizures or not asking about the smaller seizures, and people going to emergency rooms and so on. And I'm going to tell you the story about Jack D. And Jack is another patient of mine who happens to be the son of a neurologist. So we're not talking about doctors who don't care, because we presume that this neurologist really cared about his son. So he brought his son to New York because he was starting a new career after college. They were all staying in a hotel, and Jack had a generalized tonic-clonic convulsion, fell into the bathtub, cracked his tooth, cracked his head, was rushed to the emergency room. And what did they say in the emergency room? They said, this is your first generalized tonic-clonic convulsion. Therefore, there is no need to treat. It's only 1 seizure, and sent him home. And after a few weeks, he had his second generalized tonic-clonic convulsion. Again, with injuries, went to the emergency room. After the second seizure, he came to me for evaluation. And I asked him the question that I always ask, and I'm sure all of you ask, which is, so what was happening right before the generalized tonic-clonic convulsion? And he said, you know, it's funny, I was having those things that I have. Well, what are those things that you have? Well, there's this feeling like I hear all music at once, and it goes on for about 10 seconds. And during that time, people are talking to me, and I can't interpret what they're saying, but it only lasts about 10 seconds, and then it's gone. And it happens like once a day for the last year. But the day that I had that grand mal seizure, it was going on for like an hour, one after another, before I had the convulsion. And nobody asked him about the little spells, and the emergency room didn't ask him about the little spells. So therefore, he had to have another convulsion before he was diagnosed. So I'm telling you stories, and stories are anecdotes, but what is the evidence? Is this a rare occurrence, or is this a common occurrence? Well, we now have data, and the data comes from our Human Epilepsy Project, and that is a multi-center observational study of patients within 4 months of their initial epilepsy treatment. So this is when they are identified as having epilepsy and they're placed on medication. And we've enrolled 270 patients with newly treated, newly diagnosed epilepsy into the study. When we enroll them into the study, we do a comprehensive history and a structured interview to capture all of the symptoms that they're having. And we also do something called the pre-HEP seizure diary, where we ask them to the greatest capability that they can to explain to us exactly how many seizures and over what period of time they've been having seizures before they came to diagnosis, now understanding all of their seizure types. And what you can see from this data is that if their first and second seizures were both generalized tonic-clonic convulsions, then the median time to treatment is 4 days, and the median number of seizures, appropriately, that they had before they were treated is 2. If, on the other hand, they had any other combination, including one generalized tonic-clonic convulsion with other seizure types, or all complex partial seizures, or all simple partial seizures, then the median time to treatment is anywhere between 200 and 400 days, and you can see the ranges there go up well into the 5,000s of the amount of time that people wait before they get treated. And as you can also see, the range of the number of seizures that they have before they finally get treated is enormous. We also looked at the cause of the delay. So we determined that somebody's treatment was delayed if they did not get treated within 30 days of their second seizure, presuming that it might take time to get to a neurologist or get started on medication or whatever. So we looked at the number of people who had delay to treatment, and we looked at the cause of the delay. Was it because the patient was unaware of their own seizures, because the doctor was unaware of the patient's seizures, as in Devin D's case, or the doctor and patient were aware and they just decided not to treat? And this is what we found. We found that if you have complex partial seizures, the likelihood that your treatment will be delayed is actually 80%. And of those 80% where treatment is delayed, 35% of the time it's because the patient can't recognize their own seizures. They don't know what they are. They don't know where to go for help. 20% of the time, the doctor doesn't recognize that what they're being told is seizures. 11% of the time, the little triangle at the bottom, is the doctor knows about a seizure, generalized tonic-clonic, but doesn't understand that there are other seizures going on. And 7% of the time, it's an elective delay by the doctor and the patient knowing that seizures are going on. And if you look at simple partial seizures, 90% of the time there is a delay to treatment. And again, most of the time because the patients are unaware that what they're having is seizures. So clearly, a lack of understanding on the part of the public of symptoms of seizures is having a significant impact. And I want to thank Rachel Hennessy at NYU for helping me put this data together. So why was treatment eventually started? You know, the interesting thing is that the way to get your epilepsy treated is to have a convulsion. So of the 150 participants who were having simple partial or complex partial seizures as their first seizure type, they had to wait until they had that big convulsion before they got treated. So that was the seizure type that was recognized by either the doctor or the patient. Again, this absence of understanding that there are other seizure types out there. And I'm giving you mostly adult examples here because I happen to be an adult epilepsy doctor, but I know that this happens to a great extent in children and babies as well. After they had their convulsion, then people were relatively quick to treat. And we know the consequences of undiagnosed seizures, sudden unexplained death. Dan Friedman at my center told me that they had at least one patient where the diagnosis of epilepsy was actually came about posthumously after the person died of SUDEP with a generalized tonic-clonic convulsion. It became clear from talking to the family that episodes had been happening for a long time before that convulsion that produced the SUDEP. And we don't know how often that happens and it gets missed. Bodily injury, hospitalization, status epilepticus as the first presentation, neuropsychological and psychiatric impairment, and social disability as Miss G's mother-in-law, who didn't want to go out because she didn't know what was going on with her. And just to highlight that, we have another quote from the internet, again, one of these people trying to figure out what was going on with them, who describes having her first generalized tonic-clonic convulsion, driving off the bridge with her 3-year-old daughter in the back of the car, suffering multiple spinal fractures, requiring spinal fusion, and then says, "This is so interesting because I described my experience to a neurologist and they never mentioned TLE. I just figured I had a panic attack and passed out." And how often is this happening? So what is the message here? There are many consequences of lack of understanding of seizure types other than the generalized tonic-clonic convulsion. One is what we've already talked about, which is the delay, the long delay to diagnosis. The second is if the public has never heard of or never thought about the concept of a complex partial seizure, then when they see one in someone in the public, what are they going to do? Are they going to go run to help that person, or are they going to run away from that person because that person, for all they know, may have a psychiatric condition or be somebody having a fit in the street. So we have to make them understand that this is a medical condition so that they can come to people's aid. And how do we fix this? We need a strategy to increase available knowledge for both the public and the medical community. So for the public, we could increase public visibility of seizures other than convulsions. Maybe if we could somehow get the media to talk about seizures other than convulsions. Maybe we could change something on the internet so that when people look at specific searches such as dreams while awake or deja vu, that there would be something that would lead them to an epilepsy page or epilepsy.com. Maybe we could wage a campaign like the stroke people did. Know the symptoms of strokes, know the signs. So if we can do this for stroke, isn't epilepsy common enough and prevalent enough that people should know the signs? They should know that intermittent episodes might be seizures. And what about for doctors? Well, we clearly can see from this data that our colleagues need more education about seizures other than convulsions. So I and my colleagues at NYU have come up with something called the Discover form. And this stands for the diagnostic interview conducted outside of the video EEG recording setting. And it is a structured interview that can be done by a nurse or a coordinator, and we think we could probably create an online version that a patient could do themselves. And we use it to ensure that we're not missing important characteristics of seizures. I actually presented about this at NYU, and interestingly enough, a number of the general neurologists very eagerly came up to me afterwards saying, "Please, can we have the form for our office?" And it's a pretty straightforward form. It asks, what is the very first thing that happens to you during the seizure type? What happens next and next and next? And the most important thing that it asks is the question that every epilepsy doctor asks their patients. Do you ever have any other feelings, such as fear, deja vu, or anxiety, that comes out of context or symptoms lasting seconds to minutes that appear with no apparent cause? Because we know that these might be seizures. They might not, but at least we can evaluate those things, and there are certain patterns that definitely speak to us and say this person is probably having simple partial or complex partial seizures. Imagine if in every emergency room, when somebody came in with a generalized tonic-clonic convulsion, they were handed a little form where they were asked this question. I would bet you that a large number of patients would be diagnosed with epilepsy and get started on treatment much faster if such a thing existed. So in conclusion, we really need to figure out how to get the word out about seizures other than convulsions. We need to spread the word. I would love all of you to think about possible solutions to this, internet solutions, research solutions, other things that we can do to increase the likelihood that the people out there who are suffering, like the folks that I found on the internet, can get the help they need as fast as they possibly can. Thank you very much.